So Sandra, good question. So besides medications, how can you fix fecal incontinence? All right. So fecal incontinence is a very difficult thing for some people. So I will tell you, medications work. We use things like Imodium. Sometimes Lomotil helps help improve the strength of the rectum muscles. In addition to that as well,
I'm having trouble hearing you.
In addition to that as well, we also will sometimes use dietary therapy. There's some evidence that a low FODMAP diet, or a diet that is low in FODMAPs, which are certain carbohydrates very difficult to eat, that can cause a lot of gut issues, can actually help out with that as well. Another option we can do is that we can actually do physical therapy. And so very similar to the constipation question, where you have your muscles are too tight, your muscles may be too loose as well. And there's testing that we can do to check for that. And if that's the case, we'd actually have you see one of our physical therapists. And lastly, we also offer surgical therapy as well for our patients who have fecal incontinence. So there's a variety of things that we can do. A lot of it depends on what the true cause is for that.